Good afternoon. My name is Mike Eisen. I'm one of the transplant infectious disease attendings here at Northwestern and have been helping our team as we've handled the COVID-19 pandemic. Thank you for taking the time to listen to us today. A couple of housekeeping bits of information. If you're interested in closed captioning, click the CC button towards the lower right corner. Use the gear button to choose a language other than English if you prefer non-English languages. Please use the Q&A to enter questions that you have moving along. We will not be answering patient-specific questions. Those are better directed to a MyChart message so that the physicians can work one-on-one with you. And with that, I think we'll go ahead and get started. So what I thought I would first start with is an understanding of some of the new data that we have and how we can help you understand how to interpret this new data. So I'll present a few slides talking about that. Then we'll switch to Dr. Friedwell giving us recommendations for the kidney and kidney pancreas program, and then Dr. Leventhal giving recommendations from the liver side of the program. Then we have one of our superstar post-transplant coordinators, Jacqueline Fitzpatrick, who's going to help us go through some commonly asked patient questions before we open it up to questions and answers. We have a panel of experts here from the Northwestern Medicine transplant team, including Jacqueline, Drs. Friedwell, Ganger, myself, Ladner, Leventhal, Levitsky, and Tana. A few of these individuals will be joining us in a few minutes as there's another meeting that they're transitioning from to this meeting. So as we know, there are basically two types of vaccines. The majority of the vaccines that people likely have gotten have been one of the two mRNA vaccines. This is the Pfizer and Moderna vaccine. They require two different doses of the medication, and in otherwise healthy patients are associated with a 95% protection against COVID-19. The other option, the Johnson & Johnson vaccine, is a single-dose vaccine that uses an adenovirus vector and has about a 76% protective efficacy in otherwise healthy individuals. So let's understand how these vaccines protect us from infection and severe disease. Once we are vaccinated with these vaccines, two types of responses are generated. The first are antibody responses, and antibodies are what are produced in response to the vaccine and bind to viruses when you get exposed to COVID-19. If they're effective in binding the virus, you won't get sick from the infection. For a variety of reasons, these may be unable to stop the infection if you get exposed to a really high amount of virus, if there's not enough antibodies present, or if there's a variant, as we'll talk about at the end, that has reduced protection from these antibodies. You may still get infected with COVID-19 despite being vaccinated. And this is where the second part of the immune response comes in. These vaccines also produce cellular responses. These are killer cells that whose job is to recognize cells that are infected with the virus that causes COVID-19, and that those cells help clear the virus and speed your recovery. The advantage of having these from the vaccine is that they're already in your system and your body doesn't have to develop them over the course of infection. As a result, when you have these cellular responses, you're more likely to have mild or minimal symptoms, not require hospitalization, and be less likely to die from COVID-19. Now, there's been a lot of discussion about antibody responses. This has been the measure that we are, the marker that we're most easily able to measure. And what we found in multiple studies, these are 2 studies from Israel, the country that had the earliest adoption and broadest use of the mRNA vaccines, found that vaccine responses were slightly lower in terms of antibody responses in kidney transplant patients and liver transplant patients. Even in those patients that had antibodies, the amount of antibody in their blood was slightly lower than what was expected from otherwise healthy patients receiving the vaccine. In the large study that probably a lot of you have been focused on, the Johns Hopkins study, we have data from 658 American transplant recipients that have completed both doses of one of the mRNA vaccines. About half of the patients got the Moderna vaccine and half of the patients got the Pfizer vaccine. At 2 weeks or greater after their second dose, about 54% had positive results on their antibody test. But as you can see with these yellow dots on the right-hand side of the screen, there was a range of responses, with some patients having very high responses to the vaccine and others having relatively low responses. Unfortunately, at this point, we don't know what threshold is needed to protect you from infection. That's something that we're hoping to learn in the next couple of weeks as the licensure effort by Pfizer and Moderna proceeds. The advantage of this study is it was large and included all of the relevant transplant types, although some of the transplant types had relatively small numbers. What they found is that the responses were very similar between Pfizer and Moderna. This is different from their earlier study looking at patients after only the first dose, where they found better responses with Moderna. And this suggests that either of these vaccines are equally effective in producing antibodies in our transplant patients. None of the patients in these studies have received the Johnson & Johnson vaccine, so we don't yet have a lot of data on the efficacy in transplant patients for the J&J Johnson & Johnson vaccine. There have been 2 other additional studies that have come out looking at cellular responses, and the technical slide to the left really just shows you that many of the solid organ transplant patients do generate those cellular responses. And in fact, many of the patients that didn't have antibodies produced had these cellular responses, meaning that they, despite having no antibodies, should be protected in general from severe disease. There have also been several publications of patients that have had breakthrough infection despite getting both doses of the vaccine, and most do not require hospitalization. Those that do generally are in the hospital for short periods of time, and oxygen use and severe illness is relatively short-lived in these patients and rare. So one key thing that I think we need to be paying attention to is what is the state of vaccination, not just here in Illinois and the surrounding states, but in the nation in general. Thankfully, the state of Illinois has done very well. 88% of adults 65 and older have gotten both doses of the COVID vaccine. 62% of adults have gotten at least one dose of the vaccine here in Illinois, with a 48% with both doses. And 32% of individuals 12 and older have gotten at least one dose of vaccine. So we're making significant progress, but as you can see, some states, particularly those in the South and mountain states, have lagged behind other parts of the United States. These are going to be important numbers to follow, because as these numbers go up, that will mean that there are more people protected, and this should translate into lower cases and better protection for you. The last thing I wanted to spend a minute talking about are variants. These are the variants that you've heard a lot about. The two that you've probably heard the most about are the UK and the South African strain, but there's another variant that came from Brazil, and it's actually the second most common variant that we have here in Illinois after the UK variant. These have been studied in a range of settings, and really the potency of these vaccines in preventing severe disease and primary infection is preserved for most individuals for all of the variants of concern. And while there's work that's ongoing to have vaccines directed at these variants, whether or not we will need them is something that will be discovered over the course of the next several months. So based on all of this data, really it's important for us to remember a couple of things and then translate this into recommendations. All vaccines produce reduced responses for antibodies compared to non-transplant patients. That being said, most patients will have either antibodies or T-cell responses, and many patients will have both. There's similar responses with either Pfizer or Moderna, so one is not better than the other. We have less data on the Johnson & Johnson vaccine. It has the advantage of being just a single shot. I think it's critically important that we all get vaccinated and that you get the first vaccine that you're able to get your hands on. More importantly, it's important that all of your close contacts, the people that you live with and interact with on a daily basis, get the vaccine. Having them protected will create a bubble of protection around you. In terms of recommendations specific to our transplant patients, we do not recommend that you change the dose of any of your anti-rejection medications unless you're specifically told to do so by the transplant team. We do not recommend antibody testing to assess your response to the vaccine because a positive response may mislead you. You may have low levels of antibody and still have a positive result. And if you misinterpret that as feeling that you're safe when you're not, you could engage in behaviors that may not be as safe for you. Likewise, just because the test is negative doesn't mean that you have no protection at all. Lastly, we are not yet recommending additional doses of the SARS-CoV-2 or COVID-19 antibody outside of studies. While this has been shown with flu vaccine to add a small amount of response, whether or not that will be true for all patients is important. There's been a lot of attention by one patient that got a booster dose and had a response, and far less attention on a second patient that CBS News interviewed that had that third dose and didn't get the response. We really need to be understanding if this is the right thing to do and if that's the best approach to protect you. Because of all this, we're still recommending that you continue to mask, wash your hands, and maintain social distancing whenever in the public. If you're around small groups of individuals where everyone's vaccinated, I think it's safe for you to take off the mask and enjoy time with them. This is not going to be a permanent persistence of the need to use masks or hand hygiene. I think it's something that over time, as we get more people vaccinated and the numbers coming down even more, that we'll be able to make recommendations to allow you to loosen up your protection and potentially provide clear guidance on when and if you should get any additional vaccines. So I'll turn the attention now to our other transplant leaders. First to John Friedwell, who talk about recommendations for the kidney and kidney pancreas population.
So thanks, Dr. Eisen, and I just want to thank everybody for being here, and I want to thank the panel for participating as well. One thing I want to stress from the very beginning is that things are changing, and as we all have unfortunately become accustomed to over the course of this pandemic, things change fairly rapidly. And so while we're saying certain things now, our recommendations may change as new information comes forward. Particularly, and I think it's important because there have already been questions about this, is, well, don't antibodies mean something? And the answer to that is they may mean something, we just don't know what they mean yet. And so the studies, the trials that are looking at vaccination and the protection against getting the disease are also going to try to correlate levels of antibody to actual protection. And so we may know in the future more about what levels of antibodies might mean, but for now we don't know that. At the end of the day, the most important information is how well the vaccine protects against disease. And I think Dr. Eisen showed some preliminary information that there are signals that it does protect people from not only getting COVID, but getting sick with COVID. And that's the most important thing. So I do ask everyone's patience, and I know it's been hard and it's been a long time. We're all getting tired of this whole pandemic that we have very little control over. But I think for now, the best recommendation is to wait until we have better evidence. So again, it may be in the future that measuring antibody levels may be useful, but for now, we're not recommending it because we don't know what it means, and it can lead to behavior that's not safe based on what you think may be protection or not. So hang in there, we're getting close. Another thing I want to stress, and I'm just going to make some highlights about what Dr. Eisen has already told you, but currently we're not recommending reducing your immune suppression when you get the vaccine to try to get a better response, because of course it's important to step back and remember why we give immune suppression when we have a transplant, and that's to prevent rejection of the transplant, the organ itself. And if we think in the big picture, maybe we take you off your immune suppression, you get a better immune response to the vaccine, that may set up rejection in your organ in your transplant, whether it's a kidney, pancreas, liver, or other organ, and that may lead to much bigger problems down the road. So it's important to remember that we'll have you on that medication at that dose for a very important reason. Again, we need to wait a little while longer and get more information from these clinical trials. There are a number of trials, not just the Hopkins trial, ongoing around the world that are going to give us more information about the level of protection. We can't stress enough also, and I want to highlight that the risk of any of us, whether we have a transplant or not, getting COVID has to do with our own protection level, and that may come from a vaccine, but then also how likely we are to encounter someone that can transmit the virus to us. And that's why it is so vital to get everyone around you vaccinated. So I've been telling my patients, but to tell everybody, to be a vaccine champion is so important, to stress the safety of it, to stress how important it is to protect people like you who may not have as much protection from a vaccine. And we know from vaccines we've given in the past, whether it's influenza or hepatitis, we know that in general, people with immune suppression don't have as good a response. And that's why it is so important to give that bubble or ring of protection around you and get everyone you know to get the vaccine. And ask them to do it to protect you. They're not just helping you, they're helping everybody else, because as Dr. Eisen mentioned, as we get more people vaccinated, we see the rates in the community coming down. That means it's safer to go out. So the questions we've seen about, is it safe to fly on planes? Can I go to restaurants? A lot of that has to do with how likely you are to run into somebody who's carrying the virus that could transmit it to you. And as we see the rates plummet, we see that in the test positivity rate, and you can get that information on the city website or the state websites. We see that the number of cases being admitted to the hospital, as those continue to plummet with getting everybody vaccinated, it's going to make it safer for all of us to do those things that we want to do. And again, our recommendations will change based upon how likely it is you're going to encounter the disease out there. And thankfully, we're seeing pretty good uptake of vaccines, but we've got to keep going. We've got to keep the momentum up and keep getting everyone vaccinated, because it's going to make it safer for all of us to be out there, to live our lives and do the things that we really want to do. So I'll stop there and pass it off to Dr. Levitsky. And again, I just want to thank everybody for being here. To answer a few other questions I've seen, this is going to be recorded. It's going to be posted on the Transplant Village website. And so we want to make it available to people who couldn't make it tonight. It will be enduring and be captured out there for other people to see. Thanks again for attending.
Hi, everybody. I don't really have a whole lot to add. I think Drs. Friedwell and Dr. Eisen really painted the picture and emphasize, everybody getting vaccinated, and I can't say that enough. I think I totally agree about the reducing immunosuppression just to increase the response wouldn't be something advisable. Certainly, we're happy to discuss that. And in some cases, maybe it's safe to reduce the immunosuppression from your transplant perspective, but I would do that only in the context of talking with your transplant doctor. I don't really have. I mean, everything that was said, I agree with. Again, just just spreading the word about everybody getting vaccinated is really important. Getting everyone in your family vaccinated. Whatever vaccine comes up to you, I would take. I think probably I'll just, let more time for questions, because I don't really have anything additional from a liver transplant perspective. The same things apply for all organ transplants. So maybe I'll just shuttle it back to who's next.
Perfect. So the next person we're going to turn it over to is Jacqueline, who's going to talk about some of the more commonly asked questions among transplant patients before we open up for questions.
Hi, everyone. Thanks for being here. So I know this has been a really, scary time for everyone, and we appreciate all the calls and you calling your transplant team for advice. Big questions have been the antibody test. Are we doing it? Should we be doing it? And then getting a booster vaccine. So obviously those were all addressed by Dr. Eisen and Dr. Friedwell. So we currently are not recommending getting the booster vaccine, and we will not be ordering antibody testing for all of the reasons that Dr. Eisen has outlined. Some of the other major questions are, people just wanting to get back to life and normal life. So a lot of the big questions are, can we go to restaurants? Can we attend a wedding? Can we go to a baby shower? So all of those questions are, coming in a lot, and we understand that you do want to get back to seeing family, seeing friends. But as Dr. Friedwald and Dr. Eisen, talked about, obviously those can, being in large groups of people can increase your risk. So we do have to still be safe, and we are recommending that you still wear masks and just be very, very cautious with the people that you're around. I don't know if Dr. Friedewald or Dr. Eisen or Dr. Levitsky, you have anything to add about, being in groups of people or attending events like this.
I think we can get to that in the open session for the Q&A, because we definitely have some questions along those lines. And with that, why don't we go ahead and open it up to the overall panel. Thanks for going over the common questions. So here's the list of people that we have on the call. We just heard from Jacqueline, the post-transplant nurse coordinator. You heard from John Friedwald. Dan Ganger, I believe, is on the line. I'm here, Daniela Ladner, Joe Leventhal, Josh Levitsky with Transplant Hepatology, and Sejal Tana with Transplant ID. So one of the questions that came up, which I think is a great idea, or a great question, is why are we seeing such low results in our transplant population? Sejal, what are your thoughts?
Sorry, just to clarify, low antibody results?
Yeah.
So the immune suppression that you guys are on for your anti-rejection therapy makes it difficult for your body to respond to the vaccinations, to make the antibody results that we usually measure to fight off infections. It's not the whole story. As Dr. Eisen said, it's also T cells that are important, but it's important to note that this isn't just with the COVID vaccine. We see this with the flu vaccine. We see this with other vaccines as well. Unfortunately, that's just a side effect of the immunosuppression that helps save your life.
Perfect. And so the next question, I think, is a really interesting question. Getting to, so the studies, and this might be another good one for you, Sejal, is the studies that led to the licensure of the vaccines, or the authorization of the vaccines. Were they based on antibodies, or were they based on other markers?
No, so they actually were based on symptomatic disease, and if you had symptoms, then you were tested for the COVID. So they weren't actually monitoring your serologies as a marker of success of the vaccine.
Yeah, and I think it's important to remember that in those studies, they didn't have the results in real time. They just were looking to see how people did clinically. So, John, patient is gotten their vaccine and wanting to think about travel for the summer, what should they be thinking about with regard to summer travel with their family?
Yeah, that's a very important and obviously a very timely question, and I think there are a couple offshoots we can explore a little bit in terms of thinking about summer camps and kids and what they're doing in pools. I've seen a lot of great questions about that. So again, it's important to remember how likely you are to come in contact with a virus in the environment you're going into. And so, the safest environment, home alone, right? No one's going to bring the virus and give it to you, and everything beyond that. What we've learned about how this virus is transmitted is that there's a lower rate of transmission outdoors in well-ventilated spaces, I guess is the more important way to say that. And I think that's why we've seen the changes in recommendations from the CDC in terms of where people do and do not need to mask. I think importantly, and the CDC has included guidance for patients that have organ transplants or have an immune suppressed states, whether they're on cancer chemotherapy. And so they have amended those recommendations, and they're on their website in terms of what we should follow. For now, we still recommend wearing masks indoors when you're around other people. I think the exceptions there, and I'll look to Dr. Eisen to correct me if I'm wrong, is that if you're around a group of people that you know are fully vaccinated and everyone around you is fully vaccinated in an indoor setting, that's a safer place for you to be. Now, many of us still wear masks to feel comfortable, and that's totally fine. And I think we're okay, and we still would think that's a good idea. Some of the more specific questions about pools, I think in particular, outdoor pools are a very safe environment. It's obviously well ventilated, you're outdoors. And so those are times where we don't necessarily recommend you wear a mask unless you're going to be face-to-face with other people. And again, you can take the mask on and off as you come in contact with other people. One of the biggest challenges of being out in the community is not knowing who's fully vaccinated. And so in there, we would recommend the default be to wear a mask to be safe, because you don't know if you're going to come in close contact with someone who may not be vaccinated or may not tell you they're vaccinated. I do want to address one other question I saw, because I think, and I feel this way too sometimes, is what's the point of all this? If we're not going to get protection from the vaccine, why bother? And I want to be clear that there is protection for the vaccine. We have seen in the clinical trials, both measuring antibodies and those measuring disease, that people with transplants who are immune suppressed are protected by the vaccine. What we don't know yet is an easy test to find out who has what level of protection. But I don't want people to say, well, I'm just going to throw the towel in and not bother, because why should I do that? It's really important to get the vaccine. And I think that one of the big take homes from this should be that the vaccine is critically important for you because it can provide protection. And again, the other thing being to get everyone around you vaccinated. I'll throw it back to Mike.
I think that's an incredibly important point. I think there's been too much focus and attention on antibodies. So, do you have them or not? When in fact we know, and it's not just for the COVID vaccine, every vaccine that we have, we know that it's both the antibody and the cellular responses that give you that protection. And in the end, what we all want is that either you don't get infected in the first place, and if you do, you don't get very sick. And this is true for flu vaccine, for the shingles vaccine, any vaccine that we've recommended. And so, yeah, I think that I understand, because there's been a lot of tension on the antibodies, but that really is a bit distracting to the overall goal, which is keeping everyone healthy. So there's another kind of interesting question, more immunology, so I'll give this to you, Joe. The memory cells that these vaccines produce, are they going to last for a long time? Will the protection wane over time?
Thank you, Mike. And in fact, we know from study of vaccines previously that you do develop long-lived memory against certain pathogens. In the T cell compartment, you can have what are known as effector memory cells, which can last for long periods of time in various parts of your body and your immune system. With respect to antibody responses, you can have cells known as plasma cells, which can form, which can lead to long-lived antibody responses for many, many years, depending on the type of vaccine which is used. And so the issue is when you're re-exposed to the virus or a virus, is how long does it take for that immune system to rev up once you have that memory in a way that it sufficiently brings online the immune system to protect you from developing serious disease. And I think the hope is that the vaccine will help do this in a large majority of individuals, even if you don't have, a detectable antibody response. To the point that's been made repeatedly this evening, the outcome measure was, serious disease in these in the early assessment of the vaccine trials, and they clearly all demonstrated an ability to keep people from getting very sick and succumbing to the virus, importantly, and that's the reason to get vaccinated.
Perfect. So a question for you, Dan. So a patient wants to know, you told us that not getting the patient antibody testing, does it make any sense to test family members to make sure that they're protected?
Thank you, Mike. We have been endorsing, as you all heard, family members to get tested, to get vaccinated. I am not asking them to have a family, but family is a term that is different for many patients. What about those who have kids who go to school and are not yet vaccinated? I think that's an important group of patients that if the kids are not yet vaccinated, hopefully in the future they will be, those who go to elementary school or kindergarten. I think they have to remain pretty vigilant about who the kid is with and if the school will maintain some distance or the kids are going to wear masks. So I think there are different scenarios here that we have to address. But I'm not asking the relatives to get tested, but I'm endorsing vaccination.
So the next question I'll send to you, Josh. So employers are starting to ask people and their families to return to their offices, both full-time and part-time. This individual probably speaks for a lot of patients and says, I still feel uncomfortable returning to my work because my employer is not mandating vaccination, and I would also need to take public transportation to get it to work. What advice can you give to the patients that are worried in this kind of setting? What should they do?
Well, I think if you're uncomfortable with it, then you've already sensed that maybe the work environment is as supportive as you would have hoped. I mean, if you're allowed to stay out of work in that setting and you're comfortable with that, then that might be a good choice. If you kind of have to go back to work there, then I would take the principles that Dr. Friedwell said, which is particularly if you're in an indoor setting during work, is masking and assuming everyone around you, unless you know everybody at work has been vaccinated, you probably won't, depending on the size of your work, to assume that others haven't been vaccinated or have a potential to transmit. So, the indoor setting for work I still would say that if you really have to go back to work, then be very careful if it's an indoor setting with masking and using the necessary precautions. If it's in an outdoor setting, if you're an outdoor worker, I think that definitely makes it a little more easy. But again, just talk to your employer. I think expressing you're immune suppressed, and if you feel uncomfortable going back, seeing if there's a way that you can if there's any way that you can delay returning. So it sort of depends on the situation.
Great. Next one is going to be for you, Sejal. There's a couple of questions talking about how safe can we expect it to be for us if we're around a lot of vaccinated people? Is there evidence to suggest if a vaccinated person gets infected, how easily they can spread virus to others?
Yes, we should feel really safe. There's been quite a few studies, especially coming out of Israel, that have demonstrated that the risk of a vaccinated person having no symptoms and being infected is actually incredibly low. So I get a lot of questions about this. If I lived with an immunosuppressed person, can I go to the grocery store? Can I go to a wedding and then come home to my immunosuppressed loved one? And I think that the evidence there is actually quite good. But the vaccine is not perfect. It's not 100% prevention rate. So people who are fully vaccinated with normal immune systems can still get the virus. And if they're symptomatic, I think they can spread it. So I would still continue to isolate if somebody you do know happens to have a breakthrough infection.
So Jacqueline, there's some questions about which masks should be used for patients that are wanting to keep themselves protected and continue wearing masks.
I'm sorry, did you say which masks?
Yeah, what kind of masks? What should they use?
Yeah, you can use the blue paper masks. You can use the cloth masks. You don't have to be using N95 masks. But the masks that you get when you're at the hospital, the blue paper ones, those are perfectly fine.
So there's another question, and I'll send this to you, Sejal, about the safety of vaccines, even in transplant patients. What do we know about the safety? And they specifically want to know, is there any evidence that the vaccine results in enhancement of disease in vaccinated individuals?
The vaccines are incredibly safe. The CDC has an app after you get vaccinated where you can log your symptoms, and they've reported this out in several publications. As far as enhancement of the disease, do you mean if somebody's had COVID and then they get the vaccine afterwards?
I think the question is, if they get the vaccine, are they more likely to have more severe disease?
Oh, no. It's actually likely to protect you from severe disease from COVID. And we've actually seen that some people who have those long hauler COVID symptoms that have been previously infected, their symptoms actually get better after their vaccinations.
Yeah. So John, which vaccine should patients get?
Good question. Right now, we don't have information showing superiority of any one over the other. We know that in non-immunosuppressed people that the mRNA vaccines had a slightly higher efficacy. But at this point, we're recommending the first vaccine that you're able to get because we really don't know if one's better than the other, particularly in people with transplants.
Go ahead.
No, the sooner you get it, the better is what the sooner you get that protection, the better.
Yeah, I think that's the biggest take-home message is there's definitely benefit to getting vaccinated, and that benefit is guaranteed higher than if you haven't gotten vaccinated at all. So getting vaccinated ASAP and getting those around you vaccinated. So Dan is someone that has family.
And let me just, Mike, add on. I think some people have said, look, I really don't like needles. I don't like shots. The Johnson & Johnson single shot may be the one for you. And I think that's where there is some patient preference. We certainly, as you pointed out from the data that showed, there was no benefit over the Pfizer versus Moderna for people with transplants. And then, again, so I have had some people say, look, I really only want one shot. Get the Johnson & Johnson and get it as soon as you can. That's fine.
Yeah. So one question comes up. I've got family in California, another family member in Europe. I really want to see them. Is it safe for me to get on a 6.5-hour flight to California or a 10-hour flight to Europe?
In my case, if I just flew to Florida and I'm immunosuppressed too, I wore a 95. I felt safer. I don't say that is right or wrong, but I would fly to Europe or other countries if need be, or for, if you need to really go. But I would protect myself. I would feel much better. I don't know if my neighbor has been vaccinated or not. I don't know if my neighbor can carry it. So I would protect myself as much as possible in a close environment as the plane.
I think that one of the key things to think about if you are going to travel is to pay attention to what's the vaccine rate where you're going. There are many areas of the world, including places that people are still traveling to, particularly internationally, that have low vaccine uptake. They may have access to vaccines that have even lower protection than those that we have in the United States. And as a result, they have a lot higher caseloads of COVID-19 in the area. And I think the point that John made earlier was that it's a bit of math of how much COVID are you going to get exposed to, how many people are protected, and you can do some of that calculus yourself. I think the safest is to wait on travel until we get more people vaccinated, particularly in an area that you're going to. But again, I think as Dr. Ganger pointed out, if there's a significant reason for you to be going, just make sure that you're doing everything to keep yourself safe on the flight. There are some questions about school and, with vaccine only being available for patients 12 and older. What do you think about school for younger kids that are in the same household as someone that's a transplant recipient? Why don't we do that for you, Josh?
You have to unmute. Okay, so obviously the most important thing is that you're vaccinated. I think Dr. Ganger brought up earlier about kids being unvaccinated coming in out of the house. I think this is a situation where you certainly want to be careful until vaccinations are approved in a younger group, or there's been enough immunity where it's sort of safe. I think being certain that the school that the kids are going to are using practices that are having the kids going to school with masks and social distancing, it would be really important. I don't have a great answer to this question other than that is a individual that's coming in that is unvaccinated, that is at some risk. Like I said, the most important thing is get yourself vaccinated and make sure you can have your child or whoever's in the household going to school be as safe as possible.
Perfect. And then one of the questions that has come up is, are there certain activities that are particularly safe for people to do if they're, if you're a transplant patient and you're vaccinated? What kind of activities are the safest for patients to engage in? Joe?
Thank you, Mike. And thanks for the question. I think outdoor activities, clearly, because of the comments which I made previously about how the virus is poorly transmitted in open spaces. And so outdoor activities, I think preferentially, being out in the fresh air, not being out in crowds, are the sort of things which I think one could engage in and be more confident in doing, as opposed to being inside in crowded spaces with large numbers of people. I saw a question come through about baseball games, and Dr. Friedwell fielded that one. Thank you, John. Going to an outdoor baseball game is something which it's that time of year. Cubs are in first place, at least for now. I don't know how the White Sox are doing, but get out there and watch a game is something you can do. But the caveat is that, probably wear your mask when you're, sort of walking about and milling about the stadium, but you can go out and enjoy a baseball game. I personally, I think the message we're trying to send here is that you be cautious, use a hefty dose of caution when you're conducting yourself. And if you feel like wearing a mask, if to provide some extra security or peace of mind and under circumstances to do so, particularly if you have questions about whom you're going to be around.
Perfect. So another question for you, Jacqueline. So what kind of testing should the patients get after the vaccine?
So we currently are not recommending any antibody testing after getting the vaccine.
Are there any special tests that we're recommending?
I'm sorry, did you say, are there other special tests?
Yep. Do they need to have their tacro checked more frequently, their creatinine checked more frequently?
Nope, we will just continue to check your standard labs per your, your usual routine.
Perfect. So John, there's a question, has there been any connection between organ rejection and vaccination?
Good question. The answer so far is no. The vaccine seems to be safe for the transplant. That's from the studies that have been ongoing. And so again, that's why we feel comfortable recommending it and how important it is.
Great. Sejal, are employers allowed to demand that employees be vaccinated?
Employers can mandate as a condition of your employment that they need to be vaccinated. Most employers do have exemptions for religious or medical reasons.
Perfect. I'll open it up to analysis.
Mike, can I make a follow-up comment on that? I think because this has come up a couple times, and I think it's important. Some of our patients have said, I've got to go back to work, and I know my office mandates vaccination, and that is a different setting than I'm going back to work and I don't know if people are vaccinated. It's not mandated, and unfortunately, that can be a very difficult situation because whether you ask people whether they're vaccinated or not or feel comfortable doing that, it really does relate to your safety. And so I think in those settings where you don't know if people are vaccinated around you indoors, you have to default to masking and distancing as the next best level of protection. Someone asked a great question about indoor events where there's singing. We know that singing is one of the riskiest things that you can do because you're literally spreading virus very effectively. And so those are very high-risk situations where if people are not vaccinated or if you are not sure if they're vaccinated, that's considered very high risk. And so all of this is understanding the risk of the environment you're in and trying to lower it. Again, outdoors is better. I've seen questions about indoor restaurants right now. Eating indoors where people have their masks off and are talking can still be a high-risk setting, and we unfortunately can't trust people if have their masks off to know that they're vaccinated yet. And so again, eating outdoors, and luckily it's summer and it's nice out, is a much safer thing to do. And hopefully by fall and when it gets cooler again, we'll have much higher rates of vaccination and this will be less of a problem. But for now, I think eating indoors still represents a risky situation, and it's much safer to eat outdoors.
Perfect. So Dan, how about side effects from the medication or from the vaccine? Have we learned anything about whether they're more common, less common in transplant patients compared to otherwise healthy patients, and what can they expect?
I actually have not seen that. I have heard enough on non-transplant patients of side effects, the usual as expected and described, but the very serious side effects or complications that are being, publicized or really spread, I have not seen in our patients. The one concern that patients have is these vaccines are too new. I just want to say that, the community was prepared for a pandemic, and the companies with the mRNA technology were well prepared for that. I would say even for years. So the technology may sound new, but it wasn't new. And I think we're actually experiencing a miracle of how fast this vaccine have become available. And we have to be very thankful to those companies, and more to come.
Yeah, and I think the other thing that I think people have been focused on is the question of safety of these vaccines. And while their development was fast, they used the same kind of safety endpoints that would be used for any vaccine trial. And at this point, we have literally hundreds of millions of people that have gotten the vaccine, and even rare side effects that are being picked up are being identified, and really nothing has been identified that's a really significant factor that is a common incidence. Even the things such as clotting after the vaccine are less than 1 in a million, which is a pretty amazing safe vaccine, and actually is in terms of adverse effects very similar to the safety profile that we see for the flu vaccine, the shingles vaccine, and other vaccines that we commonly see. So there's also been a couple of questions, and Sejal, I'll let you tackle this. about what are we going to expect for vaccines in the fall. Are we going to need more vaccines? Are we going to need boosters? Is this going to be an annual vaccine? Can we give this vaccine with the flu shot? What can we expect?
We don't have a ton of answers right now. I think the reason that we would need boosters are if the immunity starts to wane over time, or if the variants accumulate enough mutations that our current vaccines are not efficacious enough. We can give the vaccine with other vaccines. There really hasn't been any interaction. I think Pfizer is actually doing a booster trial right now to see if the Prevnar and the COVID vaccine, if there's a better uptake. I don't know. We might need more vaccines in the future. We just don't know yet. But I'm hopeful that this will get us to a low enough rate where the virus can stop circulating and stop mutating in our community.
Perfect. There's another question that I can quickly handle because we get this a lot. Is being asked whether or not you've gotten the COVID vaccine a violation of HIPAA. It's not. HIPAA only is impacting healthcare workers or healthcare facilities. So if someone asks you for your vaccine status, that's not a HIPAA violation. You don't have to disclose that information if you're not comfortable with that, but they do, especially if it's a private entity, have the right not to provide the services that they're offering. And the way that I think about it is if you want to rent a car, you have to show your government ID, issued ID and driver's license to them. And if you choose not to do that, that's fine, but they won't rent you the car. So the way that I think about it is very much like that kind of a transaction. You're not ever required to disclose any information, but they do have the right to not give you the service if you fail to disclose that. There's another question I heard from a doctor that having severe symptoms a couple days after the second vaccines means that the body accepted the vaccine and antibodies are more likely to develop. Joe, what are your thoughts?
Yeah, so I don't know if I would put much credence in that. I don't think that's been, I mean, I don't know if we actually have studies that could draw a correlation between the side effect profile of getting the vaccine and certainly the second dose. I think is what most people have described. If you're going to have some side effects, it's with the second one more than the first, and whether that correlates at all with the type of immune response you're going to have. Actually, I think it may have more to do with your T cell compartment, and the T cell memory maybe. And so I wouldn't put much. It hasn't been studied in any sort of scientific way to know if it's anything more than just an anecdotal observation. So I think that having some sort of a reaction does mean that your immune system is reacting in some way, and perhaps that you do have some protection. But whether or not it's correlates at all with the type of antibody response you're going to have, I don't think there's any data to support that. Well, I have the mic, and just to say something about safety, because I think this is important. There've been a lot of questions in the chat about safety, and I think that Dr. Ganger and others have mentioned this. If you look, over the last, all the decades ever since we started using vaccines, certainly the polio vaccine, and the risk-benefit profile, it clearly outweighs any risk, the benefit of what we're hoping to do here with the vaccine. And the way that vaccines work, particularly the mRNA vaccines, where they don't stick around and they're not embedding into your DNA, and the question really becomes one of, the immune response, and is the immune response long term, is it going to cause a problem for you? And these immune responses, we've been looking at them with other types of vaccines for many, many decades, and we know that with very, very few exceptions, the benefits clearly outweigh the risks with these vaccines to avoiding severe illness and death from important diseases. And so I think that the field in general really, with vaccines and their safety profiles, really supports what we're doing here. And the short-term results we're seeing in literally the millions of people who've gotten it really is aligned with what we've seen with other very safe vaccines. And I think we should be very confident that long term that the benefits outweigh the risk.
So we're in the last couple of minutes, so people that have questions, please type them in, because a minute or so before the end of the hour, we'll do some wrap up. I have a question for you, Jacqueline. Is it okay to have people come into my house to do required work, like the air conditioning needs to be fixed or the plumber needs to come in and fix the toilet? Is it safe for them to come in the house? And is there anything that they should do other than mask up when they're in the house?
Well, I think having those people come into the house is, if your house needs that type of work, that's, that's perfectly fine. Definitely wearing a mask. I think, you have the right to ask that person if they're vaccinated or not. And, if they're not and you don't feel comfortable, you can always reschedule for, someone else. But I think using really good hand hygiene, cleaning really well, doing social distancing, with that person in the house is, really important. But I think, wearing your mask is really the most important thing you can do. And, practicing social distancing. That's the best advice we can continue to give if you're around someone that you are not sure if they're vaccinated or not. You have to assume they're potentially not. So just always wear your mask in those situations.
There's another question in the chat, which I think is an important one. This patient got their vaccine at NMH. They've recently gotten the vaccine card in the MyChart, but they are worried because it doesn't look like some of the other vaccine cards. Do you think that there's going to be any problems with the documentation that we have from NMH, Sejal?
No, and I think that you can actually request the CDC card, and that we can give that to you. Maybe we can do a follow-up email in Transplant Village Facebook group or something, but I think I read an email recently that they are able to give cards out if you want that, if that makes you feel better.
And you can do that through MyChart. There's an option to have it prints on a full page, so it's not the small card that you have seen others get, but that works perfectly fine. I used it to upload to United, and it was accepted without any problems. So, I think the key thing, it just has to have who gave the vaccine, which it does, what vaccine was given, what dates, and what the lot numbers are. Those are on there, and some evidence that it is from a professional organization. One last question, I'll send this to you, Dan. My wife is traveling overseas. Should she return when coming home? The patient is a transplant patient. The spouse isn't. She's been vaccinated, let's say.
So some countries are demanding that you get a PCR testing before you even come back on the plane. And some countries even, that you demand that when you arrive to get another PCR testing. I think it will depend where you go. By the way, I'm from South America. I don't recommend anyone to go anywhere near South America or Central America at this point. So I think, again, somebody who travels who has been vaccinated still potentially, if they go to a place with there's a lot of COVID, they may bring it back. There would be somebody traveling to India and coming back. If the patient, I think they still should be somewhat careful if the patient is not vaccinated. So again, the best thing that our patients can do is get vaccinated, and the worst thing that our patients can have is getting COVID because they were never vaccinated. I would finish with that.
I think we also want to make sure that a lot of questions about where to find this. Transplantvillage.org is the website. I don't know if we can put it up on the screen, but and again, I want to thank Transplant Village and everyone involved in that for being such a great resource to all the patients at our transplant center. But this will be posted where the original link was on transplantvillage.org is the website.
Yeah, and it's not available right away. It takes a little bit of time for it to be downloaded, processed. So don't look for it in an hour. It'll be in the next couple of days that we'll get, because we got a lot of comments about that with our last webinar as well. So with that, I want to thank all of our panelists for taking the time today, and for all of you for listening in. Hopefully this answered some of the key questions. I think the key take home is get the vaccine yourself. It doesn't matter which one, get the one that's offered. Make sure everyone that's around you gets their vaccine as well. Don't change your rejection medication dose unless you're told to by the transplant team. You don't need antibody testing after the vaccine, and we are not recommending additional doses of the vaccine above and beyond what's currently recommended. Until we get more of the population vaccinated and cases lower, we still are encouraging you to continue wearing your mask, washing your hands, and social distancing in public locations, and be thoughtful as you go into some of those experiences, such as outdoor activities and whatnot, to keep an eye out, keep yourself safe, but enjoy those safer activities that you can. Thank you very much, and have a wonderful night. Bye.
Bye.
Right.